Today we welcome you to this discussion and awareness program on Gaucher disease. I welcome Dr. Sujatha Jagadeesah, who is a clinical geneticist and a dysmorphologist. Her special interest is on children with lysosomal storage disorders, and she has a passion in treating these children. So now I invite you, ma'am, to tell us a little about Gaucher disease. So what is Gaucher? What are the symptoms that these children have?
Gaucher disease is basically a lysosomal storage disorder. It is a genetic disorder. It happens because of a genetic error. And because of this genetic error, there is deficient secretion of enzyme called glucocerebrosidase. So basically, in lysosomal storage disorders, there are enzymes within the lysosomes which help to break down unwanted substances in the cells. And if these enzymes are deficient, there is accumulation of these unwanted substances inside the cell. So progressively, a cell forms the basic unit of an organ. So progressively, cellular accumulation leads to organomegaly. It is the organ becomes enlarged, and finally it affects the function of these organs. And Gaucher disease is a typical example of a lysosomal storage disorder.
So can you tell us a little more about the symptoms with which these children come to the doctor or the parents? What are the findings that the parents first notice in a kid with Gaucher disease?
Gaucher disease, typically the children become pale and pale day by day because of anemia. And also they have some bleeding symptoms in the gums, and when they fall, there's a bruise. That is because of reduction in the platelet count. Platelet cells are reduced. And also, as I told you, there is accumulation of unwanted substances. So there is organomegaly, and the spleen gets enlarged more than the liver. And so the children present with abdominal distension. So that will be the presenting symptom of these children. Parents get worried because the abdomen size is increasing, and children stop eating food properly, and they become very tired, and they are not very active. So these are the presenting symptoms typically that happen in a Gaucher child.
So is this disorder easily picked up by the clinicians, or are there any differentials the physician has to think of while looking at a child with Gaucher?
In a tropical country like India, where infections are all very common, so infectious disease which present as septosplenomegaly pose a challenge. But then infections are all self-limiting, and after some time they get better. But then Gaucher disease is a progressive disease. So it crosses the time limit of an infection. So for an infection, it takes, for example, about 10 to 2 weeks to get better. But Gaucher disease is a progressive phenomenon. So you see that there is a persistent deterioration in the child's condition. And so I think it is quite easy to differentiate between an infection and a Gaucher disease. And there are other storage disorders, for example, like Niemann-Pick disease, which is another storage disorder, which also presents like Gaucher disease. So there may be some difficulty in differentiating Gaucher and Niemann-Pick disease. So that may be a difficulty.
So, in continuation with this, ma'am, so when should a family who has a child with Gaucher disease, when should they approach the geneticist or the fetal medicine specialist when they want to plan the next pregnancy? And what is the checklist that they should have before planning their next conception?
Yeah, it's a very important question. Families who have a previous child with Gaucher child have to consult the geneticist before pregnancy. So that's called a pre-pregnancy counseling, because there we will have enough time to investigate the family, the genetic mutation especially, because the child has to have two genetic errors, which is called a homozygous mutation, and the parents have to be proved to be carriers, and they carry a heterozygous mutation. That is, only one gene will have a fault and the other gene will be normal. So this status has to be proved, and we need to identify what is the actual genetic defect in that family that causes Gaucher disease. So if that is identified, then we can plan a prenatal diagnosis in the next pregnancy when the mother is around 11 to 12 weeks of pregnancy, and we can do what is called a chorionic villus sampling, and we can take a sample out of the fetus and then test for this particular mutation and say whether the baby is affected or not.
So, the best time for a couple to reach the geneticist or a fetal medicine specialist would be the pre-pregnancy period. So what if they come a little late after the first trimester, after 11 to 12 weeks, supposing we see them the first time? Is there any other testing that we can do to help them out?
Yeah, we can, but then the whole gamut, the rule doesn't change. Whether they come in the pre-pregnancy period or whether they come in the ongoing pregnancy, we have to definitely confirm the mutation in the affected child, test the parents for carrier status, and then proceed with prenatal testing. And this time, because they are coming already late, we can offer them what is called amniocentesis, which is taking fluid from around the baby, and that can be done between 16 and 20 weeks of pregnancy.
So, madam, coming back to the treatment for Gaucher disease, so now that a child is born with Gaucher disease, what are the treatment options do these children have? And how does it improve their quality of life? Do all children get the treatment or is it needed for all of them? How does it change their lifestyle?
Gaucher disease, basically, there are three types of Gaucher disease. Gaucher type 1 is the typical description which I gave with the children present with hepatosplenomegaly, anemia, and thrombocytopenia, and with bone disease, but then they don't have any neurological complications. And Gaucher type 3 also present as type 1, but in addition, there is a slow progression of neurological symptoms. And type 2, there are two varieties, 2A and 2B, where one presents with severe neurological dysfunction at birth, very early in life, and the other one presents in the fetal life as non-immune hydrops. So, type 2, I don't think there is any treatment option for these children. And type 3, before they progress into severe neurological disability, if they are picked up early, treatment will benefit because it will reduce the visceral symptoms like organomegaly, anemia, so the quality of life will be better. So treatment best works as on date for type 1 Gaucher disease because it reverses almost all the symptoms and definitely the quality of life becomes almost normal. So it is very satisfying to give treatment to type 1 Gaucher disease in the form of an enzyme replacement therapy. So enzymes are deficient in these children and so we give enzymes from outside. So and but it is an expensive treatment and it takes about 2.5 to 3 lakhs per month and we have to give it lifelong. So that is the challenge about this treatment.
So, how frequently do these children need to visit the physician? What are the social concerns that these families face? How are they able to cope up with the diagnosis? And finally, what is the help that is available from our government and other support systems?
These enzyme infusions have to be given every once in every 2 weeks, and it is given through the intravenous route. And so it has to patients typically visit the hospital where it is being given, and this involves a lot of strain on the family because every 2 weeks they have to apply leave or leave the job and then accompany the child, and also the child misses classes in school. So, and for a person with daily wages, it may be difficult because they lose the income on those 2 to 3 days, and then there is an expenditure of travel to the point of care. So these are the actual challenges the parents face. And we try to get as much as support to these families so that they continue the treatment. And also the companies who manufacture the enzymes are having a humanitarian program. So they have helped about 100 and odd children in our country to get this treatment free of cost. And the government is also now pitching in, and there is a national rare disease policy where the central government is offering around 50 lakhs rupees for one patient with a rare disease, and it can be used for a single time treatment or multiple sets of treatments. And but for diseases like Gaucher disease, where per month itself we need 2 lakhs and more, this amount may not be sufficient. So now there is a state government and a central government cooperation where funds are being allocated for a few of these children. The government also takes care of treatment of few of these children. And apart from that, there are funding sources like Impact Group, where family appeals to these foundations, and they actually propagate the message that this child is in need of treatment, and they collect funds for sustainable treatment for these children. So now things are looking much better in terms of access to the treatment and availability of this treatment to many more children in our country.
So, what about the National Rare Disease Policy? How has it helped these children?
Because now there have been centers of excellence that have been created throughout the country, where when the patient presents themselves to these centers of excellence, they are enrolled and they are given the access to the government funding for treatment, and also each state has an allocation of funds for treating such children. So they will benefit from those state allocations as well. And also this 50 lakhs amount is being given, and children can utilize it for either one time or multiple times of treatment, because Gaucher disease, just enzyme replacement alone is not enough, because they need periodic investigations to examine their bone condition, some periodic MRI, periodic scans of the liver and spleen sizes, and also the pulmonary function. All these have to be evaluated periodically. So typically they have to come for review at least once in 3 to 6 months to the clinician. Just starting enzyme, we cannot leave these children alone, because other complications have to be monitored as well. So for all this, there is an expenditure, and these funds will be able to help these patients to achieve the optimal care that the child needs.
So, how frequently should these children be monitored for these complications?
When the child is typically diagnosed and is on treatment, for the initial few months, it will be like whenever they come for infusion, we will monitor them. And slowly the review becomes monthly, and then 3 monthly, and then it becomes 6 monthly. But the child who is not on treatment needs more frequent reviews, because the child is not on treatment and we need to closely monitor for complications. For example, if anemia is very severe, then we have to give them blood transfusion. Thrombocytopenia is there, we have to give platelet transfusions. So, and if the ognomegaly is becoming very severe, then we might plan for surgeries like splenectomy. So, for all these, and even a bone marrow transplant can be planned as alternative therapies to these children. So, they all require more frequent monitoring than the kids who are actually on treatment.
So, apart from the medical aspect, so what can the families do regarding their diet and lifestyle changes for these children?
There is specifically no diet for these children as a recommendation for Gaucher disease, but generally the nutrition should improve. So anemia can be because of nutritional causes, which can be rectified, and the vitamin D levels are typically checked in these children. And if there is a low level of vitamin D, that can be supplemented. And generally, they have to be on a balanced diet with the regular diet advice that is being given to growing children. There is no specific diet advice. And apart from that, getting help from families who have similar problems is a very, very important thing that patients should understand. So that is why we formed a support group for lysosomal storage disorders children. And now it is a national lysosomal storage support group that is there. And what is the purpose of forming such support groups? Because parents know that they are not alone fighting this battle, and there are many other people like them. And also, they can learn from each other how they overcome the challenges the child faced in the day to day living. Because everything the doctor cannot be explaining or advising. And learning from others with similar experiences will be much better in daily living conditions. So, that is also important. And also the social stigma, because children, they come every 2 weeks for an intravenous transfusion, so they have to inform the school authorities, and the relatives also come to know. And so definitely the child has a sort of a psychological impact that the child is suffering and has to have a lifelong treatment, and the child feels there's no relief from this. So the child, especially in the adolescent age, when they want to be free and they want to be on their own, it sort of gives them like a restriction in their activity. So we have to give them appropriate psychological support, that because of the treatment they are able to live a normal life, and that's okay. So that concept has to be inbuilt from the beginning, and these children have to be given the courage to face these situations and still believe. So this is the psychological support that these children should be given.
So, I understand that the society also needs to be more inclusive.
Yes.
So, how do we spread awareness? How do we make the society aware about these conditions? Or even the physicians for that matter?
So, conducting periodic CMEs, that's what we do here, to teach postgraduates and practicing physicians about the early pickup and early diagnosis of these conditions, because there is a treatment available. the earlier you treat the children, the more benefit the child has. So, spreading awareness is by continuing medical education conferences. And public awareness, we give talks in the media, and also we write in newspapers so that people read, and in books, magazines, so that the public reads about them and then get an awareness. And like that, we have got a lot of referrals also because they read in a magazine and they found that the neighbor's child is having a similar problem which is there written in the magazine, and they take interest and bring the child to us. So definitely public awareness improves by all these sources.
Thank you, ma'am, for that excellent discussion. We would be very happy if you can quickly sum up a few important features about Gaucher disease, when to suspect, how to prevent it in next pregnancy, and the various awareness schemes and the support groups that are available.
So, Gaucher disease is, as I told you, a genetic disorder, and it is a lysosomal storage disorder. It is progressive, and the children typically present with huge organomegaly, anemia, thrombocytopenia, and early pickup is very crucial. An enzyme diagnosis followed by a molecular diagnosis is required for confirmation. And if there is a first child with a problem, parents should present in the pre-pregnancy period for genetic counseling. And there is a 25% chance of recurrence in every pregnancy. And once the family mutation is noted, we can offer them prenatal testing in the form of a chorionic villus sampling at 11 to 12 weeks of pregnancy. And treatment is available in the form of enzyme replacement therapy, which is giving a very satisfactory response, and children lead a near normal life. But it is expensive, and so there are government agencies now coming in which are helping both the state and central government, and also agencies like the army, ESI. They are also supporting the treatment of many of these children in our country, and also funding agencies like Impact Guru. They collect funds from the public and support the treatment of such children. And also support group has really paved a way because it has brought together all the patients with LSDs in our country, and they are able to fight for their own rights and also to educate each other as to how to overcome the daily hurdles in their lives and still be confident and positive about this country.
Thank you, ma'am. So I think we can fight towards a better future for children with Gaucher disease. Thank you.
Thank you.